Welcome to Family Medicine in 5. Today we're going to talk about testosterone. Sometimes I like to talk about the thing that I'm seeing a lot in clinic, and this kind of comes in waves, and so we've had a couple questions on testosterone this week. Testosterone is the normal hormone that comes out of the testicles. It helps develop men into men, and it gives them we call it the power hormone. So it makes you feel powerful. All women have a little testosterone too, but of course our estrogen is more than our testosterone. And so sometimes what we often hear on commercials and things in these hormone clinics is, oh, if you've noticed that you feel you're more tired or you feel that you have lower sex drive, maybe it's your testosterone. And there's some truth to that. Low testosterone actually does cause what we call low libido, which is lower sex drive. Muscle mass will start to decrease, body hair decreases, and we often see a lot of fatigue. Know that after 40, testosterone just starts to go down. And so not everyone that has lower testosterone needs or wants supplementation. To get a real testosterone level, it's not just one lab. We actually have to do 3 labs, and they're drawn between 8 and 10 o'clock in the morning. Testosterone changes throughout the day, and so the most accurate is between 8 and 10 a.m. If we determine that the patient has those 3 low levels and they have the symptoms and they want to proceed with testosterone, we often have a big discussion first. We bring them into clinic and talk about risks and benefits and administration. So the benefits of testosterone are awesome. Patients often love testosterone. It makes them feel powerful. It helps their muscles continue to grow. Patients often say, I went back to the gym and I feel so much stronger. It actually improves things like bone density and sex drive. I always remind folks that it's not sexual performance, it's sexual desire. And so if it's mostly desire, then it can be testosterone. If it's mostly performance, we look at things like Viagra, and we look at diabetes, heart disease, other things that cause microvascular damage. But testosterone is not without risks. One of the first things is it decreases sperm production. And so if I have a young guy that is looking into testosterone supplementation, I always remind them, if they still want to have kids, then this may not be the route for them. Actually, what's super interesting is one of the things we use for folks that want to maintain fertility is Clomid. Clomid is a medication that we use to stimulate the ovaries to secrete more eggs. And so same thought process, it actually stimulates the testicles to secrete more hormone. Other risks is increases risk of prostate cancer. And so if you have a patient that has a history of prostate cancer, we shouldn't be using testosterone. It increases slightly cardiovascular risk. So if you have a patient with uncontrolled heart disease, we try not to use testosterone. It can increase the size of the prostate. So we see what we call BPH, which is that enlarged prostate that men have a hard time emptying their bladder. And one of the number one things that we see in clinic is it increases the hematocrit, and so it actually puts patients at an increased risk of stroke. So personally, I have all of my testosterone patients take a baby aspirin when they are on testosterone therapy. If that hematocrit gets too high, we have to do something called therapeutic phlebotomy, which is we actually, they go and donate blood, or we take them to the hospital and they donate a pint of blood, so it actually thins their blood. So if the patient wants to proceed and they understand all the risks, there are a few ways to administer testosterone. First of all, orally, we know it causes liver damage, so we actually don't do it orally. There are a few preparations that we've been trying to get an oral medication, but I don't use any of them. So I either use topical or I use injectables. So topical is one that comes in gel or it comes in creams. Patient applies it on the inner leg, but if I have a patient that sleeps with a spouse or has little kids in the home, I don't use topical, because if any of that rubs off on the spouse or even on the kids, women can grow beards, little kids can start to accelerate their sexual progression. And so even if a wife is, washing the clothes of a man that has that and they get some of that testosterone on them, there have been reports of FDA consumer reports where some of those incidents happen. And so I usually try to steer men away from that if they do have a spouse that they live with. So we do a lot of intramuscular injections. These are injections that are traditionally given once every 2 weeks. You start them between 100 and 200 milligrams. It's called testosterone cypionate. And so then we recheck the labs, and we'll talk about labs in a second. And so the labs are done exactly at the middle point. So if I'm giving a patient 200 milligrams every 2 weeks, then what's happening is initially when they get the shot, their level's going to be really high and it's going to taper down. So I don't want to check the lab here and I don't want to check the lab here. I want to check the lab completely in the middle. So I check it right at 7 days, and it's really important that the patient comes right at the midline. So I know, is that medication enough or maybe it's too much? Remember, those risks increase as we put them on too high of medications. We want to give them the benefits while controlling the risks. And so when we do start testosterone therapy, there are labs that need to be done. So we check the PSA to check for that prostate cancer risk. We check the testosterone level, of course, to make sure we're giving them the correct dosage. And then we check what we call a CBC, which is a complete blood count. So we need to check that hematocrit and make sure their blood is not getting too thick. So there are risks and benefits of testosterone therapy. It's definitely one that we want to be careful with, because one of the things that we don't want to hurt a patient. We want to give them the benefits without giving them too much risk. If you think that you might be low on testosterone, it's good to have it checked, but remember, you need 3 of those tests. So I hope you learned something. Let me know if you have any questions. Thank you.